Hi, buddy. It's Jeff here. So I'm in a restaurant. They have it's more late at the end of the morning. They're still doing some cleanup to try to before lunchtime. So they're gonna have a little bit of. They're still trying to wash the floors and stuff and all that before all the people come for lunch. So that's France. In the States they'd be doing this like at 6 in the morning before people come here. They do it done Sunday morning when just a couple of people are here at breakfast. But hey, whatever. So what I want to do is deal with a post on LinkedIn about healthcare and whether or not there's a whole thing of a lot of different comments about it of universal healthcare and all that stuff and I want to come from it from having grown up in the United States and spent half my life in the United States and then spent my other half living in Europe, especially in France, where it's a very different perspective on healthcare and education. But I just want to deal with the healthcare point right now. So, I what I want to do is mention a few things that will help us begin to think about it. And I've seen this over posts on LinkedIn and Facebook over the number of years, and this has become a topic where I've refrained from responding at certain points of time, just because, especially during the healthcare kind of renovation, whatever Obamacare, whatever it's called. I can't remember the name of back in about what is 2000 and between the 2012 and 2016 period of time, right? And there were times when I didn't say anything on Facebook or LinkedIn just because it was, it just caused a lot of debate. Now it's coming around again, and I think it's a good time to be able to say it because I'm making my videos on working with the French, my video books on working with the French, working with the Americans, and all that. And so I'm actually talking about this. So I've actually in my working with Americans or understanding with Americans video book up on my YouTube channel at Jeff Allen France. I do talk about healthcare and education. I do talk about it, but here I want to talk more specifically about it, and then I'll just add this as another, subchapter or section in that video book. And I talk about the French one too, or I will. This will add to the French one, right? So as well. So sorry, I got a little bit of background noise, but that's what it is. They're washing the floors. I'll just talk louder, okay? So just make sure that we get the sound coming through. But hey, that's the timing is just. It's 11:30 and they're washing the floors, right, on Sunday morning. So, so the about 7 years ago, probably in that period of 2012 to 2016. I don't remember exact date and time. Didn't actually take a photo or a screenshot of the Facebook thing. I should have done it because then I'd have at least something to refer to. And I'm not going to name the person that did it, but at that point in time, there's a whole thing whether healthcare was a commodity or what it was, right? Was it a necessity that government should provide or not? It all comes down to that. It all comes down to is healthcare something that should be covered by taxes that are levied by the government at local and federal levels, and is it something that is considered as a necessity for citizens? Okay. As a citizen, do you have a right to have health care? It all comes down to this, right? And should taxes be levied to cover this, right? And I do talk about this in my work in the Americans thing, that Americans don't want to pay taxes. It's been from the beginning, since the Boston Tea Party. It's all against paying taxes. Everything's about against paying taxes. The whole thing is to not pay taxes to the king, right? And it still hasn't, because now we don't pay taxes to the federal government. So it doesn't matter who, right? It's been on for 300 years. So I'm going to say 300 to round it up. Whatever. And the whole history of things against paying taxes. You can see it. Whereas European countries like France and Germany, paying taxes allows you to have certain benefits, and the benefits is for the entire population, not for specific individuals. So this comes down to this whole individualistic culture against collective culture, which I talk about in my video series and work with Americans and work with the French and work with the Germans. I talk about these things, right? And I refer to them and I explain them. So I'm not going to re-say those. Go to the videos and those video books. They're all free. And go to things on, specifically on individualism and collectivism, where I talk about it per culture. I mention this. But this does reflect it. So do we pay or not pay taxes based on an individualistic versus collective mentalities of certain cultures? Um, do we want to or not? Okay, and then the whole healthcare thing comes into play on this because it comes down to, is it individualistic or is it collective in our perspective? Are we do we only pay, do we pay healthcare, do we pay taxes to pay for healthcare for the entire population of citizens? And I don't want to go into the thing whether or not the non-documented, aliens get it or not, or whether they, I don't want to go into that thing because that gets even more deeper, right? But I just want to talk about citizens, okay, or residents that have legal residence and all that, okay. I just want to start there. Do we pay taxes so that those people, residents and legal residents and citizens, get health care at a certain minimal level, um, as a benefit and as a necessity that is offered by the government or not? I mean, it comes down to that, right? Um, so in Europe, yes, it is considered to be that. It's considered to be a, I don't call it a universal right, but that's what I'm gonna call it, okay? Because we call it about universal health care. So everybody gets it, right? So, but then there's a false notion of being free, right? See, a lot of Americans see this as, well, it's free, we're getting free. No, it's not free. You got to pay taxes for it. That's why in France you pay, 25 to 30% tax out of your personal income to pay for this stuff, and then your companies pay 55% on top of your salary to pay for part of a lot of the stuff. So it's not free, okay? It's everybody pays to it. It's just you get a benefit from it, and it's a pretty insignificant benefit to have health care that doesn't cost an arm and a leg and 5 fingers and 10 toes and and everything else, and cutting your head off, right? And a few internal organs that you have to pay to sell, right? So what happens is, and I've benefited from this. I've had a child born 9 weeks premature in the middle that did benefit from this, right? And our family benefited from not being on debt until the end of our lives, right? Um, and I've gone through an education system for my master's, and I've been from the education system that's not, doesn't cost, again, 10 arms, 5 legs, and everything. Um, but the whole thing is, it comes down to, so is it this collective approach where it's citizen a necessity that the government should offer, or is it something that is individualistic? It's from an individual decision to pay a premium to be able to get that healthcare and education, right? Same thing. Um, so and from the individual point of view, and I did see this post on Facebook I'm going to mention that said at one point in time that, hey, I was thinking, and I work in the translation technology and service industry mainly. I mean, I've worked in other industries too, and I do, but the whole thing about, there's all been a mention since Mark Homnak and some Simultrans brought out in the late 90s, 1999. I remember it coming up in a lot of things. He said that the translation service industry is seen as a commodity-based industry. And so I've applied this to the whole healthcare industry and education too, but I said this for several years, that I was fearing that I was seeing that the healthcare topic was becoming like a commodity-based approach, right? And someone on Facebook, a former colleague from a former company, did say one day in that 2012 to 2016 period time frame that healthcare and education are commodities. That was his perspective, and it shocked me because based in the U.S. and just basically said, people that have the money to pay for it can get it, right? That's what it comes down to. As a person that had money, right, and had always been able to sell well and get money. But the whole thing is, this thing is not about people that have money, right? It's about people that don't have money, right? Not everybody's rich. Not everybody's going to be able to get a lot of money. And the current situation in the United States has been that, healthcare is an astronomical cost just for premiums. I mean, the amount that I pay for my healthcare and my additional, in French they call it mutuelle, but I'm just trying to think of it. It's additional kind of health insurance or whatever it's additional coverage, which brings it up to, paying for up to 100% of some stuff, right? right? I pay a premium, but I pay like 40 euros a month for this, right? But that's on top of, but that's what my company offers. My company has to offer this. It's a legal requirement to actually offer healthcare benefits on the additional healthcare benefits. It's actually a legal necessity, right? Because it's seen that all because health is an important thing in the French system. Um, Whether or not it's going to be return on investment or not, and all that kind of stuff is, it just doesn't apply because the French government says that health is important. But that's the French government's approach. It's not the U.S. government's approach. The government's approach, and what the people say is that we don't want to pay taxes, right? So we want to pay the least amount of taxes possible, and then you get the things that you want to pay for, right? Which means that you will, and I've seen this in other topics too, and I'll mention those in another video, but where it applies to other things too, right? Even at your workplace. But so does the whole thing come down to, is it a benefit, a tax focused benefit that is offered by the government and your job, or your job, where it's a requirement for them to offer this to you as a citizen or as a resident or as a employee, or is it not? And it all comes down to that. And then this comes into the fact where this is, someone said in one of these posts, and I can't remember the name. I just took notes. I'll just post it here. I'll post my video and make sure that you see it. Where it says it's called the cruelty factor, right? And so the whole thing is based on cruelty of not allowing you to have something, right? Not allowing you to have this benefit. But it all comes down to is it a benefit or not? Is it something that should be allowed as a benefit, a required benefit, or not? Or is it something that you should, as an individual, so collective benefit, right? Collective approach, collective socialism, and all others, right? Where it's collectivism. All the countries and cultures have collectivism as a focus, or is it individualism? It's not. It's not a benefit. It's an opportunity to get a benefit. It's an opportunity to get a benefit, not a required benefit. It's one that you can opt for by paying for it, right? And paying more for it, if you got money. So, and is health something like that? Is health something we should treat as that? That's the big question. And I think that's something that this is a different, just the North American U.S. point of view it's. I'm not saying everybody. I'm just saying that this is a divided thing, a very divided question, and a significant amount of the population, let's say half, think that it should be something that you got to pay for, and the other half says, well, we should be able to get it as a benefit by the government, right, and pay taxes for it. But see, it's too late in the game for the U.S. to make this decision. It's just going to be too expensive because the whole Obamacare we can see was a failure, right? Because of this, because the people didn't want it. And it's too late to be able to change this, right? Whereas in Europe, they started with this. They'd say, hey, look, 50 years ago, we're going to offer this to everybody. After the Industrial Revolution had already come through, we want everybody able to not be sick and to be able to have health care and to be able to do it. So we're going to offer this universal health care that they're going to pay for, right? Through taxes. There's just no choice. And now, you can see where we are with it, where it's become a necessity to pay for additional health care, where you got to pay for premiums to do that. But it's leveraged across the entire population. So it's a big pool. You throw it all in the big pool, and everybody you benefit. Whereas in the States, the United States is based on every single employer has a different benefit program. So it's all kind of like hodgepodge, and there's no mutual. You can't leverage the entire whatever because there isn't an entire people. So it's kind of like paying CDs. Everybody that buys the CDs is paying a high price, or DVDs paying the high price for all the people that are pirating, right? Because there's not enough people to pay for it that don't want it. They want it for free. People pirate want it for free. The whole thing of people don't, there are people who can pay for it and people can't. So it's a sad. That's what it is, right? So I want to just state that as is. I see it. This is my perspective on having lived in two different countries, half and half of my life. So, and have seen it from both points of view and have benefited from each of the systems in different ways. But I make a choice of where I want to live, right? And I choose to live where I'm going to be able to get this health benefit and education benefit, and that's another topic. and for me and my family for long term, because because I think that I value that, right. I don't value the so much the thing of not paying taxes, just to be able to. And when my kids aren't, when we don't need it anymore, we're not going to ask for, we're not going to have to pay for, right, something that everybody's going to have to pay for. That's the way it is. So that's my thoughts on it, and hope this adds to the discussion. No one's right, no one's really wrong on this whole topic. It's just what it is based on global worldviews, right? It's a worldview issue, and we have to see this. That there's no right or wrong. That's the hard thing, worldview, and that's why I bring up my videos about working with the French, working with the Americans, working with the Germans. No one's right or wrong, right? They're appropriate in their own cultures, but the problem is when you start talking across cultures, the worldviews are different, and this is where it gets really complicated, because everybody's calling out each other, but the thing is they're calling out each other, but from a different cultural point of view. And then when you're in a culture, or in a country, in a culture, and you get a different 50% of each of the population, 30, 30, 30, all have it's actually 50-50, but it starts getting balanced when you have multiple points of view, and then they're all beginning to debate. When you only have this dichotomy, it's just polemic, right? It's just fighting. It's going to be really hard. So that's at least my perspective. Take it as it is with a grain of salt. Really, so it's I think about it. So having my experience with that, significant experience in both countries, right? Both types of mentalities. So that's it.